picking the patients for the studies has got to be a real trick and an art. And then I would also think to Robert's point, there's it isn't just the drug, because most of these patients are getting therapy with the drug. And how are you kind of designing that aspect of these studies as to, are they getting a certain level of therapy prior to taking the drug, a certain level of therapy afterwards? How does that factor in?
Absolutely. So I think what we've been discussing so far, they're really sort of the three pillars from decades of research when these substances were actually legal, and there was much more research done. Really, the three pillars were understood to be dose, and we've been talking beyond dose, but to the underlying pharmacology. But really, if we put that into one pillar, sort of the dose and the mechanistic effects at the pharmacological molecular levels, and then really the other pillars are really psychological effects. They are the set and setting that is classically discussed. And these, as you say, Deborah, have to do with the person factors. Those are really the set. So what is this person like? What do we know about this person? For example, their trauma history, clinical information that we may have about their depression, their personality type, their attachment status, their early life experiences. All of these are going to come to bear potentially and predict the kind of experience they're going to have under the effects of the substance. And then, of course, there's a setting which has to do with the immediate surroundings of the place in which the substance is consumed and the therapy takes place. And all of those are very important. And really, it doesn't, it's not an easy prediction, actually. While we can make a fairly clear prediction around the dosing of the substance, and a higher dose, of course, is going to have a more significant psychological effect, it's more difficult to predict these set and setting factors. And so those are going to be very important in the design of the trial. When we're looking, as we've already discussed, we're looking at potentially treating people with PTSD and depression, with significant trauma histories, veterans, for example. Those factors are going to be very important. We're going to want to do a very thorough psychological assessment before, and we're going to want to take extraordinary care during the experience to make sure that the person is not overly distressed, is able to essentially understand the experience, and make use of it as much as they can towards their recovery. And a lot of that is going to be in the preparation phase and the integration phase. As Rob really said, the effects of the substance are not just potentially the period of time of the drug half-life, and 8 hours you've mentioned, Deborah, is often a prediction that we could make, but there's some individual differences around that. Is it 6 hours? Is it maybe 10 or 12? But in any case, there's that, there's the acute effects, but then there's also the sort of integration phase, which, as Rob alluded to, might be a period of days, even weeks after, in which the person continues to remember a lot of what occurred and engages in, a process of trying to understand what happened, what is the meaning of that, what have I learned from this experience, and how can I, take that experience and transfer it to my greater life, hopefully as a means to recover from the prior difficulties that I experienced, perhaps as a veteran or in other contexts, different traumas I may have experienced in my early life, more recent life. This experience is going to bear on that. It's going to give me some messages, give me some information, give me some different perspective potentially. And we're going to internalize that, not just during the period of acute intoxication, but over the days and weeks subsequent to that.